Welcome to Joint Center Orientation. In hopes of making your experience a smooth one, we'll be covering some important points to be aware of prior to your surgery with us. Prior to your surgery, if you develop any signs of infection, call your doctor to report these problems. It may be necessary to reschedule your surgery due to the risk of infecting your new joint. In the weeks prior to your surgery, your physician may request labs or other testing and your medical doctor's clearance. Your physician will also provide instructions on proper hygiene at this time. The day prior to surgery, you will receive a notification of your time of arrival on surgery day. Notifications should be received between 2 and 6 p.m. If your surgery falls on a Monday, you will be notified on the Friday prior to your surgery date. If you do not receive any notification by 7 p.m., please call 334-528-1287. Your home medications may be adjusted. If you are on a blood thinner, ask your physician if you should discontinue this medication prior to surgery. Typically, you will be asked to stop this medication 5 to 7 days prior to your procedure. Anti-inflammatories should be stopped for 2 weeks prior to surgery. Insulins and diabetic medications should not be taken the morning of your surgery. Please note that your glucose levels will be monitored during your stay. Lastly, chemotherapy agents should be addressed with your surgeon. You may take the following medications the day of surgery with a sip of water: antihypertensives, Parkinson's, cardiac, thyroid, seizure, reflux, pain, antidepressants, antipsychotics, breathing, steroids. On the day of your surgery, you will want to be sure to bring the following with you: medications, loose, comfortable clothes, toiletries, electronic devices and their chargers, closed-toed shoes that can be adjusted for swelling, CPAP machine if necessary. Check-in is located in the outpatient surgery center. You can expect that each phase of surgery will take about an hour to complete. These phases include pre-op, surgery, and recovery. One visitor will be able to accompany you during the pre-op phase of your surgery. Other visitors will be able to visit once you arrive to your inpatient room after your surgery has been completed. Your orthopedic surgeon and the anesthesiologist will visit you during pre-op to discuss your plan of care, and your first dose of antibiotics will be given. You will receive 24 hours coverage depending on the physician preference. Once out of surgery, you will enter the third and final phase, recovery. Pain management is a priority at this time. Your recovery room nurse will take special care to make sure that your pain is addressed appropriately. The orthopedic surgeon will update your family in the waiting room after your surgery. After your surgery, you will be moved to your inpatient room. Your room will be assigned to you on the morning of your surgery, and all rooms are private. It won't be necessary for you to bring your own equipment during your stay, and a visitor is welcome to stay overnight. Immediately following your surgery, you will be able to have a clear liquid diet. Your diet will be advanced based on your tolerance. During your recovery, you will be closely monitored through devices and diagnostics. In addition, your physician may decide to insert a small drain to monitor the amount of drainage that occurs. If inserted, this drain will be removed within 1 to 2 days after surgery. Sequential compression devices, or SCDs, will be applied to your legs to promote circulation. It is recommended that these sleeves be worn to minimize thrombus or blood clots, with the use of a blood thinner and increased activity. Be sure to request assistance prior to getting up for any reason during your stay. If applicable, surgical dressing will be changed, and instructions will be provided on how to care for the incision. You will receive a visit from physical therapy, occupational therapy, and a social worker. A physical therapist will work with your rehabilitation. An occupational therapist will help you learn how to perform your everyday activities of living, and social work will discuss your discharge plan. This may include the equipment and rehab options after hospitalization.